Okay, well, let's get going. Good morning, everyone. As you can see on the PowerPoint, and I hope everybody can hear me and see the webinar that Kelly put up there. It's the MOTS still last time / Roads EDI webinar, and it's for the Oregon Health Authority. And today is March 5th. And I'd like to welcome everyone. And this is our monthly webinar that we have had for quite a few years, and hopefully we will have many of them more coming in the future. Every first Wednesday of the month at 9 o'clock, and it was all MOTS, and it now will transition into all roads. And we shifted between EDI webinar focus and client entry focus, which means today is the EDI focus, but it's still a lot of general information. So, because I sometimes get the question like, well, if I'm not an EDI, I just do client entry, should I attend those other ones and vice versa? And I always recommended everybody to just join or at least check the agenda that we have up, and if there's really nothing that interests you, or you figured and maybe you're too busy and you might check it later, because there always could be some valuable information from anybody giving any questions or anything. So okay, it is recorded, so for those of you who can't make it through or get a little called away for something that has higher priority at the moment, you can always find it on our website and review it later, or share it with coworkers if you think their information is very pertinent. And so, okay, as you can see, we have quite the agenda, and it's the Pete Vermeer and Jody Kramer show, as you can see. We are going to talk about the team objectives and the Roads Go Live update. And then, of course, it's all EDI stuff from Jody: version, certification, training, monthly reports, access, MFA, all that great stuff. And then we'll finish it off with some next steps, questions, and of course, our contact information. Okay, let's go. Let's meet the team. Our two very important people are, of course, Kayla Camelli and Jody Kramer, our Roads product owners, because as of next week, and you probably heard already, we're going to be calling ourselves the Roads team, and the MOTS is slowly going to fade away. Myself, for those of you who do not know me, Senior Systems Analyst, Pete Vermeer, and we have Mary and Cecilia as support specialists. You probably talked a lot to her or emailed a lot with her, because they are the kind of like the first line of defense that we have for anybody comes with any questions on the support and the help email boxes that we have. So Justin and Anna are our report specialists. Justin also does research, and Anna a little more data analysis. And if you have any questions about any of our data that you have about the mod stuff, or any in the future the road stuff, Justin and Anna are the people to talk to. If you have any questions, you can send them to the help desk, but then they will probably come through you, and they will contact you to get any additional information if necessary. And we have a junior system admin, and that's Lisa. She is joined our team a couple of months ago, and a big help. And of course, Kelly, the one who sets up all these lovely webinars and does the majority of the communication between everything and everybody, is the communications analyst. I think that's a very nice title. There's a couple of more people that didn't make the screen today, but hopefully next time we'll be able to introduce some other people that we also have working and helping us out as part of the MOTS/Roads team. Okay, next slide. What do we try to achieve when we do these webinars? Every first Wednesday of the month, I already said that, we have this webinar, and we talk about what roads things are going to happen, the go live timeline, key milestones. Especially starting up, there will be a lot of changes and a lot of updates and a lot of things that we envision in a certain way that might need some tweaking, that probably needs a little review about different things that we haven't completely foreseen, because we try as hard as we can to make sure that we're prepared for everything, but there's always something. So the other thing we do is compliance, and we cover any file submission, reporting, provider communication, MFA setup. That's a new thing that we haven't had in the past, but with security requirements in general, with anything and everybody going on the internet and more access and more stories that we don't want to hear. So we need to make sure that our security and firewalls are up to snuff, and any training options that we have, because we have multiple training options for people who want to do EDI or want to change to EDI or want to say, well, maybe we should just do the client entry. There's all kinds of training options. There's trainings going on. We've had some trainings already, and you probably, maybe one of you have been there, and hopefully there's quite a few more coming. What are the next steps after we've gone through the transition? And any questions that you might have, hopefully we can kind of answer them here, or if we don't have the answer right away, we will definitely make note and definitely try to get back to you as soon as we can with as much and the best information that we have. So that's one of the main things that we like to do, is try to communicate with you and try to help you to make sure that everything is clear and you know where we stand and you know where you stand. So, okay, and then the next one is ta-da! Fireworks. Rhodes is going live. We are very excited that we are going live on March 11th. And March 11th is a Tuesday, and that's an interesting day, but that's mainly because it's kind of like over a weekend, and then we can kind of start going through the transition over the weekend. So it won't bother as many people, and we can kind of stay off a lot of real-time live action works. And as of next week, Tuesday, MOTS should be frozen, and Jody will tell you a lot more about the details and how that is going to take effect. So, Jody, up to you. And if you have anything for me, just let me know. There we go.
All right. Thank you, Pete. And thank you all for being here. I'm super excited seriously, about the turnout. This is amazing. So we're looking forward to bringing you some good information. So there are some things that we know with March 11th is next Tuesday, less than a week. And so some of you might have some, like, maybe not anxiety, but just like, okay, worry, what's happening. And so we're going to go over some key points that we think are important for EDI providers. And of course, the EHRs. We thank you as well for being here. I see a number of you on this webinar. So your file submissions and go live. March 5th tonight, actually at 9 p.m. All files submitted tonight at 9 p.m. will be the last files that are processed through the MOTS system. From that time to March 11th, any files that you submit or your system submits on your behalf, such as a few of like Dr. Cloud, who submits files, I just call you out because that's what I'm thinking of. Anything that you submit into the inbound folder will sit there and it will process once Rhodes is live. There will be no file processing from March 6th to the 10th. So if you go in there and you're like, hey, I put that in there yesterday, don't be alarmed. They're just sitting and waiting for Rhodes. When Rhodes does go live on March 11th, it will pick up the files by 9 p.m. and the files will start processing that evening. Now, the provider FTP, your logins and your credentials, there are no changes to that. So your existing login, your current passwords, nothing is going to change. If you're using FileZilla or some of the other software transfer tools, everything is going to be just keep doing what you've been doing for the last X amount of years, right? The FTP inbound and outbound structure is going to remain the same for your submissions and your results. So absolutely no change there. The processing schedule for Rhodes, for now, it is going to be daily and it will continue to be at 9 p.m., 7 days a week, 365 days a year. We don't give MOTS or Rhodes any holidays like MOTS. It's got to do its business all the time. So all of your historical data that is in the MOT system currently over that weekend Pete is referring to will be migrated into the Rhodes system. So you won't need to, yes, these are Pacific times. So they are definitely Pacific, yes, West Coast times. Um, so you don't have to worry about resubmitting any data or anything like that. It should flow smoothly when your files come in and just match up with your existing data that was in MOTS. Okay. Any thoughts on that so far? Does everybody feel? Can you give me some thumbs up if that made sense? That you don't have to do anything really different. Okay. Well, I saw one, so that's good. There's two more. Yay! Thumbs ahoy! So sounds great. Okay.
Plenty of thumbs. Wow.
Yes, you guys are awesome. Well, we have been working really hard, and we tried to make this, I shouldn't say painless, but as streamlined as we could, as less disruptive as we could. And no, the URL, the host, and everything for your FTP files is staying exactly the same. The same FTP server is going to start partnering with Rhodes and picking up and returning your stuff. So literally, you should have no change in the process that you're doing to get your files uploaded to the Rhodes system and MOTS system. All right. Yes, Kayla and I really worked hard, and the rest of the team, but to really guide this ship to hopefully be as much as possible of a less of a burden and not just a massive technical overhaul for no really good reason. So we've tried to streamline some of this. So the big thing that everybody's probably excited about or nervous or curious or whatever, because this has taken a long time, are the EDI, what we're calling version updates, and then, of course, the supporting documentation. So the EDI data dictionary, and I called it the companion guide, but it's basically the data dictionary and the file specifications document. They are expected to be released April, and I put 2025 on there so y'all would know I was meaning this year. So, and you can put laughy faces for all of those that you've been waiting forever. Um, but we wanted to make sure we had a couple more things program staff wanted, and we wanted to get that included so that we weren't sending you another version in just a few months. Like, that is not cool. So we figured you'd rather wait and have it holistic. So the current MOTS EDI format that you're sending today and will be sending to Rhodes will now be referred to as the Rhodes Legacy version 1. Okay. The new version is going to be called Rhodes EDI version 2. And this includes some new data segments such as Real D, stabilization services, mobile crisis. They call it the burn network, or was known as Measure 110. There will be some modified fields in existing segments. So the existing segments are staying. So like your CPD segment, your BHD segment, these are client profile data, behavioral health data, addictions data, involuntary service data, crisis data. These segments are all sticking around. Okay. They may have some fields that get added to them, changed, or sunsetted, but the file structure itself is remaining the same. So you should have an easier transition. Nothing's easy, but with what is staying that was there before, we are kept all the values the same, the mapped values and things like that. So this shouldn't be a lift from the ground up, although it will be some modifications of what you've been currently doing. Um, the Z codes should be accepted. We have been, maybe Kayla can address that because she's been working a lot with all the diagnosis codes, procedure codes, all the codes we've been getting in the system. Um, so the EDI V1 versus V2, when do you use which or what? Well, we know that since you don't have the documents yet, because it's not April, you're not building, you're not scoping, you're not doing anything to get to V2. So all existing providers using V1 are going to continue to do that, just like I mentioned in the prior slide. Keep batching, keep creating your files, sending them just like you do today. Now, when you get the documents and we get a chance to get to the point where you want to send them, they will be required to be certified. So if any of you have been around during a transition to a new EHR or back in the day, you need to get your files certified, and those will be at a provider level, not an EHR level. Okay. Um, Providers that are switching EHR systems after go live, because I know there's a number of you that have been working with us. Um, you know, you will have to still certify. So, like after we go live, if you're like, hey, I'm moving to ABC EHR, you're going to need to use their version 1 until they get version 2 up. So, um, once Rhodes goes live, you can't just like be like, oh, I'm going to this EHR and I'm going to wait for version 2. Like that probably isn't going to work too well. So if you're in that position or in that place, we will help you through it. Um, can you go to the next slide, Kelly? Because I'm not sure if it tags into this one. Okay, yeah, it did. So um, the EDI certification and you know another Steve word, the compliance word, right? So what is the process and what are the expectations? So any existing V1 providers, such as all of you today that are currently submitting already into MOTS, you do not need to recertify or do anything different upon go live unless at a later date you change EHR systems. Any new provider or system that is submitting V1 must be certified in Rhodes before sending production data. And what we mean by new provider or new system is somebody who's going to an EHR after we have gone live. All EDI V2 files will require certification before the actual use. My office assistant might have to get relocated. Um, anyways, so EDI V2 collection. Okay, so we're going to give you the docs, and in April is the plan. The actual collection is going to begin somewhere early in Q4 or late Q3, okay, of 2025. And the slated go live is September of 2025. So um, we have some transition planning tips that we want to talk about. Um, 1 second here. All righty. I am back. Can you hear me, Pete?
We can hear you fine. And when you said
Excellent.
slated, that means the current plan is to be ready around there. It's
Yeah.
not a hard date yet, because we all know things change.
Yeah.
Just
I
a
mean,
little FYI.
yeah, it's according to leadership, it's a little more than semi hard. It's not a semi soft. So like yeah, but we'll have a little flexibility here. So
Good.
um so the transition planning, let me start back with that one. So we know that because like Pete and myself, we kind of come from the technical world. And so we know that an EHR system, when you get these documents or your in-house IT specialists are not going to spool this up overnight. Okay. So it could take, we know, anywhere from 3 to 12 months reasonably to implement major changes. So what our goals are is once we have those documents released, OHA, aka Jody and Pete, possibly, or others of the team, will meet with the EHR vendors and your providers within 60 days. At that point, what we want to do is we want to be able to have a kind of an open conversation and talk about your development timelines, maybe some of your testing schedules, expected rollout dates. These were just some examples. Of course, number one, development timelines are important. Um, what we want to do is OHA, if we're going to work as part of your EHR and providers team as like the state's technical person So if you have like beta groups, you set up work sessions, we will make sure one of us is available to attend those. We want to make sure we can answer questions, remove any type of barriers, things like that as you're starting the version 2 development. We want to do this process so that we as a collaborative can determine a cutoff date for EDI V1 submissions. And we really want to try as hard as we can to baseline this on EHRs, your IT staffs, and your timelines. Okay, so we know it's not a complete overhaul of what you've been doing, but it still is a significant lift because there's your UI UX where your staff are interacting with this field collections, and so really our goal here is for everybody to be super transparent and to be able to just speak to what might be a barrier, what might not be a barrier, so that we can find a reasonable timeline that we can recommend to our leadership and management. And then, of course, they will take those things into consideration. So just know V1 will be going away, but we'd like to work with everybody to really get your feedback and your timelines. Okay, so I've been doing a lot of um, fire hosing you with this information. So is everybody following along okay?
Maybe just a little clarification that when we slate to go live on the V2, there will still be plenty of room for V1 to keep going because we try to have a transition period of 6 to 12 months, and some might be done in 6 months, but others might need a year. So during that transition, V1 and V2 are both going to be not for your one HR, of course, but if somebody is not ready yet, they can still keep doing the V1 while others will start working up the V2. So that there is definitely going to be an overlap. Just an FYI.
Yes, absolutely. That is exactly. Thank you, Pete, for adding that in. Because yes, we know y'all won't go at the exact same time. So
Right. Sometimes if you say, hey, we're going with V2, people get worried like, oh, but I
yeah,
still have V1. There should be plenty of overlap to have both going and make
yeah,
sure that everybody is there.
yeah, yeah. The system's been designed to accept both, and actually, the system, the road system, is probably like 90% there for V2 now. So we've already got a lot of it laid out and working in the system. So the next few months is just nailing those documents by April or in April. And yeah, so you'll be able to do both because we know some might be ready to spool up quicker than other EHRs. Um, there's five of the EHRs that are housing a huge amount of the providers. And so we know that there's going to be some, coordination that has to happen when you have, 10 to 20 uh, customers, right? So, okay, well, let's pop to the next one. There we go. Okay, so training and provider portal access. So with the go live right around the corner, Kayla, Kelly, Mary, Lisa, they have all been just heads down training our manual providers that have to enter data through the portal who don't have an EHR and send it electronically. So the decision was made to roll out training in phases. Okay, so the EDI training is going to be the phase 2 piece because currently we're doing the portal training. The EDI provider trainings we slate to begin in Q3 of 2025. We want to look towards June-ish, if that's a word, but that's kind of where we're wanting it to be so that we can get you into the portal, get you trained, so that you have access to what is available before you start, getting your EDI V2 stuff there. Now, the provider portal features for EDI users, like you're probably like, well, what is that? Because MOTS was kind of didn't have a whole lot going on. Well, you're going to have read only access to all your submitted client data. So the historical data, new data that comes in, there's dashboards and reports. We have a new submitted file review area where you can look at certain things that was associated with your file, like your file level errors, your transaction level errors. Some of you may find this helpful, some of you may not, but as we go through the training, you'll be able to determine how or what you want to use or look at. Okay. The communication and next steps is really, we're going to be focusing starting in April. This is a big month, EDI April month, um, with getting you set up with what are called P numbers, what are called partner numbers, and multi factor authentication access. Now, just to be clear, the FTP server, dropping files on and off, that remains the same. It's your organizational access point. Keep doing that. But to get into the portal, you all get your own individual access points and your own individual passwords. Okay. So some of you may have them that are probably disabled or not used. So look for some instructions that are going to be coming from either the Rhodes um, or Rhodes, Mots, or Jody um, for the how we're going to go about getting that done for you. Because we figure if we start in April, that'll give us a couple months before we get to training. Because in order to train you, you all need a partner number, which is unique to you. And you will need to have multi factor authentication, which I think if we pop to, there's another slide that's going to come up. So if you've got some, oh, there it is. Perfect. Okay, so for the portal access and MFA, there are some steps that are required. Again, each of you has to have your own partner number and multi-factor authentication. So P numbers will be set up during April and May. We're going to get together and have a plan to get information out and to work on these. The MOTS support team does the bulk of these, more than the bulk. I don't really do much with them other than just try to help. So each provider's manager will submit an access request form. These are online now with a cool link, so it's much easier than in the past. Your multi-factor authentication options are a Microsoft Authenticator app, which some of you might be familiar with. I know some of you got started early because you've been reading the newsletter and stuff like that with getting MFA. So uh, big hand claps to you who've already been doing that. If you don't have the ability to use the Authenticator app on a mobile phone, then we have an option called a YubiKey. It's a hardware authentication little device. So we've got some options for you. Our OIS team, Kelly and Kayla and the crew have spooled up support with our OIS team. So they're offering multi-factor authentication support group sessions, one-on-one sessions. So when you get the information, you'll be highly encouraged to join those. There's some processes. Once you get the P number, you get your temporary password and you got to get your multi-factor. But no worries if you're overwhelmed at this point. That's okay. We've got some nice stuff that's going to be coming, quick start, step by step, things like that. So I think the team's grabbing stuff in the chat. So I'm going to try to, I'll let you all grab those real quick. Okay, so monthly reports and provider communication. How's this going to work? So we are going to continue with monthly reports. Okay, so monthly reports will continue to be sent to the primary contact on file, to including but not limited to the active client monitoring reports, your non-Medicaid service reports, and your performance reports. Those typically are the main reports. There might be a minor delay in if you don't see them at the 1st of April for your active client monitoring reports. No worries, we're going to be letting you know when they're coming. Justin King and Pete have been working hard on getting all of the ways and roads to refactor all that into your reports so they look recognizable and helpful and all of that good stuff, because you're going to need these in the meantime before you get into the portal. So general communications and updates, we're going to send regular updates. They'll probably come via email with critical information. Of course, we're finding critical, which are going to be training schedules, portal access setup, and of course the EDI documentation releases. So some of you might get double duty on these things because you may get them because you're already part of the distribution list. that is for our MOT support. Um, okay, I'm going to make one mention here in 1 second. The 1 second, yeah, documentation. Okay, I just had a squirrel moment with those shiny notifications popping up. So,
Don't
like,
we all?
yeah, that's totally funny. Like you can
And
tell
lose
I'm
your
not
train of
total.
train of
Yeah,
thought and kind of like, where am I? Who am I? There you go.
yeah, I'm like totally. You can tell I'm totally not total scripted, right? Um,
Nope.
so, um, I think Kayla. First of all, Kayla mentioned that I called them P numbers because they used to be called P numbers and partner numbers, and we're still kind of transitioning lingo. But you might hear them called UPN, and that stands for
User principal
It'll be
name.
you. Mm-hmm.
Sorry.
okay, okay, awesome. So UPNs, P numbers, MFA. When if you see anything about that, they all go together. Okay. I also did see Colette. Thank you very much for bringing this up. I saw it with my other shiny object about the results files. So the results files for version 1, the legacy. Um, can you guys pop in the chat what the UPN stands for? That'd be awesome. Um, the results files, Colette, and everybody else, because those are critical to you being successful on fixing stuff. So they are going to be identical to what you have been getting. We also did work with Reliatrax and Dr. Cloud. So shout out to both of them. They ingest the results files automatically. So we did a bunch of, well, we did some testing with that here about a month or so ago, so that we made sure that those results files would be accepted by those that are parsing and doing some ingestion of them. So we also, our team, I don't think it's TMI, but Anna and Kayla Gray, they worked with us, and we took Rhodes results and MOTS results, and we literally went through them line by line to make sure that we were as absolutely close as possible to provide the same type of uh, error messages, the same or better. Okay, so everything should flow just like it is if you've been bringing them into Excel through our instructions. Some of you download the results, you put them in Excel. That still functions properly because I've been doing it. Um, so yeah, that should just flow like it has been.
Operative
And
word here is should, because we tried and we know there's so many messages and
yeah,
situations and options and possibilities, and maybe the order is a little different than you used to get it if you have those memorized, like, oh, we used to do this and it came out that way. Wording, typos, tiny little things might be, but and definitely Anna and Kayla did an amazing job to go through all these huge documents and going through all of them. So we tried to be as close as we could. I don't think we can give 100%, but
no.
98.
Yeah, I was thinking we're way better than an 80-20 rule. I think we're
Oh,
definitely like
definitely.
probably 95, 98. Yeah, I mean, so yeah, it's been an undertaking, but we this bird's gonna fly out of the nest is what I keep telling everybody. So um okay, let's pop to the next one. I know we're getting closer to aha, there we go. So some next steps. We definitely we're going to be preparing for the cutoff date, and we talked about on March 5th at 9 p.m. After that, your files won't get picked up until the 11th. Expect the EDI docs in April of 2025. I like to say that 2025, so you know what year. Um, I felt like the boy that cried wolf for the last 3 years on these documents because I kept saying, "Oh yeah, we're going to be right around the corner," but it's just the nature of what it is. So, thank you all for being patient with us. Um, Also, look out for the when we do put out V2 certification and testing. details later in the year. Just keep checking your inbox for training details and the portal access instructions. And now I remember what I lost my train of thought on was some of you are on you've signed up to get roads information, or you're on the MOTS distribution list. So some of you are going to be getting some of this information through there. Some of you might get it twice because I also have you in a distribution list that I've kept over the years for that Pete and I can utilize for EHR folks, like anybody who's associated with MOTS at your organization. So if you get them twice, it's better than not getting them at all. So just please bear with us, but we want to make sure you get all the information. So Larry, non-Medicaid service submissions in V2. Larry, can you expand on that just a teensy bit? You can come off mute if you'd like. I don't, are they all force muted?
No, I didn't.
Okay.
I think he's wondering if there's any changes or more changes.
Yeah. So basically, sorry about that. So non-Medicaid services are sticking around. They are going to be in V2. There are maybe one or two more fields that have been added to the non-Medicaid services for V2, but it is going to roll the same way, basically, as the individual reportings for the individual services provided to a client with the procedure code, the bill charges, the units, the diagnosis code, the start date, and end date. A lot of you don't put the end date in because it's not relevant, which is fine. And yeah, I think still basically, most of you have it tied to the billing side of your EHR somehow, because you're pulling the build encounters out through there. And oftentimes you're using the claim number as the transaction ID. So all of that for V2 should be the same. Of course, when you're sending non-Medicaid services, the road system will at least have had to have received the client's full reporting in a status file that was accepted. And once the client is initially in the system, then your non-Medicaid services can be sent for that client and they will match up.
And I saw a question about revenue codes, and I know there has been talk about service elements, but that has been going back and forth. And is the jury still out on that one, or have they decided? Because I might have missed that end of the conversation.
We do have service elements built into version 2 because it's built in a couple locations. It's built in the non-Medicaid services, and it's also built in the behavioral health data segment, I believe is where it's at for, there's some reasons why you might need to use it there. So, and then we also have another field because sometimes needing to know the exact MMIS number that you're billing particular clients under to the OHP Medicaid system, since we don't get the billed stuff directly through the road system, we wanted a way to be able to tie that. And so there will be some information on that field. So yeah.
The revenue codes that I'm talking about are because we have a number of contracts with payers who want intensive outpatient services billed as if they were inpatient, meaning we have to use revenue codes like we were billing on a UBO4 instead of CPT codes like we're billing on a HCFA. And right now, MOTS kicks those back. The non-Medicaid services error file, any 906 is kicked back. You don't receive it. I've put that I've put that in several places. We've talked about it on MOTS webinars like this one before. We've talked about it in when P numbers were issued and some of the different things that have come up over the, what to take into consideration as you're transitioning from what you're now calling legacy and V2.
Okay. So Jessica, so for these revenue codes, are they sitting in like are they in place of like a
Instead of a
procedure code?
90853 or an
Okay.
H0005, it would be a 906.
Okay.
So
So this
these are
is
procedure codes, right?
Yes.
In our system. So maybe that's something Kayla Camelli can take a look at
yeah.
and get back to you about the details, because we have a certain list and we are expanding on it, and we should have some flexibility. So
Yeah.
I
Okay,
think it's
because
best to
right
take
now
it up
you
with
are
her.
not
Sorry.
capturing this data. There are several Dewey clients for whom the error files come through, and I can't do anything about that. You guys just don't accept
Mm.
the code.
Did you pick up on that, Kayla?
Yep.
Excellent. Thank you. Sorry about that. Yeah.
Yeah, that's okay. And Jessica, how many of these codes are there? I mean, just a
It
rough idea.
it's just the one. Well, 906, and it might be also a oh gosh, what is the other one? 916. Primarily for us, it is a 906. And really this is a payer specific thing in that the way that because of the definition of intensive outpatient at a payer level, they don't care that we are an outpatient facility only. They handle the claims as if we were an inpatient facility.
Okay, gotcha. Well, and we have this recorded, and I know we're at like well, it says 105, so this must have got started way early. But we can have the ability to, for part of our teams, to go back and re-review this, um, the information that you've provided, Jessica, so we can make sure we get it exactly correct. Um, and if you would be so kind to send us another email, sounds like you have already, but if you would send us another one, we will tag that onto it for Kayla to and us to follow up on. The nice thing is the new system has more flexibility, so we should be able to make some accommodations. Awesome. She said she will do. Um, okay, well, we're at a point here where you can pop things in the chat. You can unmute yourself, raise your hand, and ask any type of questions. This was a mouthful of information. So, yeah, Larry, go ahead.
Hey, good job. Can you hear me okay?
Yes, you sound great.
Yeah, you guys, this is going to be really exciting. Thanks. Hey, I was just curious if we've submitted information, supplementary information for a client and with Roads V1, and it's sitting in your database with all the fields that are needed for Roads V1. And now it's time to update the information for that client, but it's Roads V2 time. And so there's some additional fields that you're going to have, I guess, in Roads V2.
Yes.
So, the what's sitting in your database is incomplete. It has only the V1 information.
Correct.
And so
Yes.
when when it comes time to make a new submission, we're going to have to, I guess, add the extra fields and remove the other fields when we make a V2 submission for that exact same client.
Correct.
So one of the problems is I'm not sure we know what you actually have in your database for these clients. We think we do.
So the information that we have on them is the information that you all have been submitting. Um, we have built the system in a way that the V1 is coming in and being mapped over to relevant locations for V2. So when you do come up with V2, there shouldn't be a gap. I mean, the first time once you're certified and you submit V2, those fields will then become populated for the client based on what you sent for them.
Right. I'm just worried a little bit about, new clients are not a problem. It's just the old clients where you've got data in there from V1 and we're going to send new extra V2 data in. So it sounds like we just send it and
Mhm.
you'll just map it in.
Yeah. it's, it's
Okay.
it's gonna be slick. It's gonna be slick, Larry. Yeah. No, we knew this was going to have some challenges for us, and so the our contractor is Ernst and Young. They are the folks who have been building the system in conjunction with our recommendations, and so we knew it was going to be tricky with V1 and V2, and where the portal manual users are going to be entering V2 right away, what we call V2, right? Because that's what's in the portal. So um, it should match up and be okay. And some of the fields that are literally getting sunsetted are being housed in a section we call historical fields that we know. There aren't that many that are actually going away. I probably less than 10. So like most of them are sticking around.
Great. Well, hey,
And the,
one,
and the
one,
transition will only be for active clients because the ones that were submitted in the past are the historical data, and so and we give you a monthly active client list, so that should give you an idea of what how many there are that might need some changes and some additions and stuff like that. So, and if you
yeah,
if you worry and you're not sure, you can always approach us with a question of your data. I do remember in our earlier phase of the MOTS that we had data extracts, and I remember Jody had an amazing list of just pulling everything from a client,
yeah,
And
and I
she
Justin's
does.
done an amazing job
and
doing that now.
Justin he has taken over a
Let me
lot of
just
those. So.
give you one more pain point that we have, and that is that we drive Jody crazy trying to get updated passwords for SFTP sites. And I'm hoping you can give that woman some rest with providing some automated way to get that.
We didn't want to overwhelm everybody, but we there will be some exciting news as we move into the latter part of 2025 because we are going to be doing a transition to moving to what they call an MFT
Mhm.
server. You're all going to be shifting over. Nobody freak out. It's going to be totally fine. Pete and I have got it handled with our folks. But when we go to that, Larry, there is an opportunity for some of you that have fully built integration and automation for us to work through getting non-expiring passwords. They're a little bit long, but
Oh,
and it's a
that's fine.
process. But we definitely, so I'm sure you and Dr. Cloud folks will be thinking that's awesome. So more to come on that. And yeah,
Good, good.
yeah,
All right. Exciting. Thanks.
yeah, yeah. I see another hand up here. And if you want to go ahead and speak.
Yeah, hi. My name is Heminder Singh. I work for a small agency. We use MOTS to input data about our clients, and that's the only interaction we have. So I'm a little confused as to what I'm supposed to do. On the one hand, you say MOTS will not be available for data entry after 11th of March, and but then you also say that there will be training provided in starting in April. So what am I supposed to do between now and when the training happens?
Hey, quick
Different
question.
kinds of trainings.
Well, wait quick question.
Sorry.
Do you submit data through an EDI file, or do you
N-
submit data through our MOTS web portal?
The what the MOTS web portal, one client at a time.
Okay, excellent. Okay, so what we're going to do is we're going to make sure Kayla, Kelly, Lisa, if we can take down their name here And what we're wanting to do is connect with you because you actually will need to attend one of our trainings that is specifically for portal manual entry users. I'm glad you've been here because you did get a lot of information, but they're going to get you the training that you can get signed up for right away so that you don't have to wait. So when March 11th happens, and as long as you have all these pieces in place, they will make sure that you have what you need to get spooled up to enter data. Okay?
Okay.
Yes, I'm actually going to put in the chat right now a link to our most recent Roads Navigator newsletter, and that has all the links to the upcoming training dates for the portal training. So that could be handy for others on this call if they need similar information. So that is in there.
And we have
And
several coming up, right? In the next
yes, we
couple of
do.
days.
Yep. Yep. So hopefully there's something that works with your schedule. We have morning and afternoon sessions throughout the week. So hopefully there's something that works for you.
Okay, thank you. And if there is a mailing list for things like this, if you can add me to that, I'll appreciate that.
Yes,
Yeah,
of course.
you can
Definitely.
put your email in the chat, then we can add it. That'd probably
Okay.
be the easiest way. Thank you.
Okay, thank you.
So I'm kind of going back through some of these questions. Okay, there's the revenue codes. Okay, so Kurt Smith put your deal in here. For providers using ReliaTrax EHR for the portal, do you expect there to be a smoother transition from Roads V1 to V2? Can you maybe elaborate just a tiny bit? If maybe they may have left. Basically, the transition for most EHRs from regardless of which one you are, from Roads V1 to V2, I think from a technical perspective, and I know we have some EHR folks on here, the fact that we didn't overhaul from V1 to V2, basically V2 looks and feels the same as V1. We just added additional data segments and allowable fields to be collected. So I suspect it should be slightly smoother than if we'd have gave you a whole new file layout and specs and changed all the map values and the codes and stuff like that. I think I don't know if any of you EHRs want to weigh in on that.
Yeah, and I think going from client entry to EDI the first time is quite a transition for an organization because a lot of things are changing and a lot of unexpected things come up. But once you are working with an EHR and you don't have to worry about entering in multiple places, you just have your system, your EHR, and then there's programming in the background that will, or maybe some buttons pushing to extract that information and submit it to us. The tweaks that we're going to ask from V1 to V2 will be minor. So, and you're already in that process of just entering your data in your system and running that programming to extract. So I think it'll be easy. Hopefully it'll be easier.
Okay, Larry, I see your hand up has a 2 by it. So.
Yeah.
Two
I don't
hands.
know.
Wow.
I guess that's my second question. Hey, I forgot to thank you guys for doing such a great job on the transition here. We expected it should be pretty smooth because the support you gave us, I don't know, 5 years ago was super, and this seems like you've even upped your game on the support. What my question is, is it going forward in V2? Will it still be like V1 where they're all either only on EDI or client portal, but they can't do updates on both of them?
Correct.
Yeah, but so the client portal, once they switch to EDI, the
It's available and read only. You can get some of your information. It will be viewable, so you can compare and make sure that the information in there is correct. But you can't update that, because otherwise you might get data corruption, because then you are able to update it in two places, and then EDI stuff comes in of something that you have changed manually, and that can kind of corrupt the data. So we can't do that.
good. Good.
Yep.
All right. Tally ho.
Yeah.
Thank you.
Yeah. I see, Jessica, you have your hand up again.
Hi, thanks.
Yeah.
One thing, I sent that email just, I don't know, 2 minutes ago, so hopefully you can take a look at that. And then I have another question. I believe that what I heard earlier is at some point down the road, you or somebody on your team will be working with Qualifax and a number of us CareLogic users to take a look at what roads looks like, version 2. Do you
Yes.
know right now if there is a way to allow for a client to decline to answer a number of the Real D questions? Because currently our paper packet for Real D, I would say 98% of our clients take that packet and immediately check the box that they're declining. They don't even read the data to give us any of those values.
We have a decline option.
Okay.
Yeah. Kayla, right? Kayla did a lot of that. I'm leaning on my counterpart. Yeah, everything that you get in, like, we built the Real D off the literal specs from the Office of Equity and Inclusion, like
Oh,
off their Real D repository thing. So that we heard it loud and clear. Y'all were a little tired of having multiple requests for different value sets. So we just used what they had.
perfect. Yes, I think you've heard lots loud and clear, because this sounds like it's going to be a much smoother rollout than
Yes.
MOTS was. Thank
Yeah,
you.
I hope so. I know
Thank you.
Pete and I were around for, well, Pete was around for all of it. I came in about 2014, but yeah. So we're trying to use as many lessons learned and scars that are remaining as a reminder.
And try to share those lessons learned, but people
Yes.
don't always listen. But
Yeah.
that's
So
another
gee.
story.
Yeah, definitely. That'd take a whole nother webinar. No.
Or two.
SOGI is included in the Real D. There's
Yep.
a set of fields at the, I just remember it being at the end of the Real D stuff. So yeah. Some of the error messages are going to be a bit more clear, because as we were doing the stare and compares on them, if the roads one was already a better, more clear message, then we kept it instead of making it be unclear. So hopefully you will enjoy some of them a teensy bit more. Yeah, hallelujah's right. Dumber. Yeah. Example for addictions, what values should appear for Real D and SOGI? Okay. You know what, Thomas, maybe what we can do is we can set up a time. This is one of the things, Jessica, and for any else of you that want to entertain this. So Jessica, I have reached out to CareLogic and working with Jessica Coleman and I think Paulina Silverstein from the Credible side, but we are wanting to do just a CareLogic specific targeted, hour meeting so we can talk through some of these things and what we're doing and where we're at. So that offer goes out to any other EHR that's on here. If you do want to take us up on meeting with you and your partners, if some of them may or may not have been here, we're happy to set those up so that we can make sure you're getting attention specific to you and your group, and we can answer any questions. So please reach out to us if you want to do that. Me.
Thank you, Jody.
Yeah.
Yeah, maybe Kelly can put up the contact
Yep.
slide. So, because we're running over time,
Yes,
actually.
sorry we've ran over. This was a mouthful, and there are still 63 of you here being active. So I just want to thank y'all just for being so patient with us and working with us. We are this team. I can say everybody I work with, it's like we take a lot of pride in what we do, and we really try to think of you and the clients. So, um, yeah. So with that, if um, I think that's kind of all I have. Anything you want to add, Pete? I
No, I
appreciate the
think you're
hand
good.
claps.
I like. Thank you. Yes, thank you. We try, and I think Jody has been doing an amazing job. She's been our champion at the moment because I was off to have to do other things because of certain situations here and there. But coming back, it's Jody and
Yay!
Kayla and the rest of the team are definitely doing an amazing job. So, but sorry, we're running out of time and we have to end this. Rhodes email, rhodes@odhsoha@oregon.gov. Any other questions you might have, anything we might have missed or wasn't clear. As I said, it's recorded so you can kind of go back and kind of tap through it and see if you can get the information you're looking for. If it's not there, you know where to find us, definitely. Okay, thank you all very much and have a wonderful rest of your day. Thank you.
Thank
Thanks
you.
all.
Appreciate it.
Thank you.
Thanks.
Thank you very much.